Good morning. Well, I'm here wearing several hats, but I should be speaking on behalf of the New Life Psychiatric Rehabilitation Association, despite what Lester talked about all my different roles. However, I think my different roles have helped to inform me in playing my role as the chairperson of the New Life Psychiatric Rehabilitation Association. Being a psychologist, a mental health professional, I've been involved with New Life for 40 years. That shows my age and seniority. And I started, I think, about 10 years after the association was formed. And so I'd like to share with you the transition of New Life from traditional volunteerism, which I think in the late 60s, early 70s, most of the NGOs do-gooders. We are service providers. We help to provide service to the needy at that time. And how does it transit to modern board governance nowadays? And we're trying to get rid of ourselves so that we are not blocking the development of the association. So many of you have heard about New Life. We're a psychiatric rehabilitation association providing different types of services for people recovering from mental illness. In the early days, we are doing mainly rehabilitation work, but nowadays we are doing more, a much broader range of services, ranging from aftercare services, but also for mental wellness promotion and support for carers of people who are in recovery. And the organization started, like many NGOs in Hong Kong at that time, based on the need of the users. So in 1959, the New Life Mutual Aid Club was formed by Dr. Stella Liu, who at that time was an assistant medical officer at Castle Peak Hospital. She started group therapy for patients, and it worked. And the patients like to continue, but they have to leave the hospital. So a group of people in recovery of mental illness got together, and they formed the New Life Mutual Aid Club. And in 1961, it was registered. And at that time, the committee members were elected from among the basic members, who included persons in recovery, and some of them were volunteers who were mental health professionals, and they were also observers from the hospital trying to oversee the work of the group. They started to rent a private flat, I think in Sam Shui Po at that time, and then a factory building unit to start our first male halfway house in Hong Kong, and the first shelter workshop for people with psychiatric illness in recovery. It was renamed as the New Life Psychiatric Rehabilitation Association in 1965, with service expansion, having more professional personnel elected to the committee. Early on, it was mainly the users, and then later on, we have more mental health professionals joining the committee. And at that time, in 1966, Dr. Raymond Wu Wei-Yong Yi-Sang, was elected as the first chairman of the executive committee. He served for 40 years in that role. I know nowadays it's not considered good governance. But in New Life, we have very dedicated volunteers, and many of us have served the organization for decades. And in fact, I'm going to rid myself of my job this year. This is my last year as the EXCO chair. I'll talk about this transition later on. Well, in the early days, the EXCO members, the subcommittee members, we were all volunteers, and we all helped to develop New Life. In the 70s to the 90s, we set up the organization structure with a president and a vice president who play more symbolic and honorary role. And Mr. Ho Sai-Chu is our president. And he has been the president for many years also, as long as Dr. Raymond Wu. And he said he was going to step down when I stepped down. We tried to keep him for a long time. But his role mainly is to ensure that the EXCO is in proper order, and he runs the AGM. But the day-to-day running of the organization are in the hands of the EXCO and the management. In the early days, we also set up subcommittees for each service unit. They started first a male halfway house, and then a female halfway house, and then a number of other shelter workshops. So a subcommittee is set up to look after each of those units, and mainly consisting of psychiatrists, nurses, social workers who participated in rendering services even. We went down to talk to the users. We advise and supervise the staff in our spare time. And we have subcommittees reorganized later on to take care of different service functions. So not a subcommittee for each service unit. So later on, we have a quality assurance subcommittee, which was changed to a quality assurance and continued quality improvement subcommittee in 2008. We have an enhanced productivity program subcommittee, and then because we have different units in the regions, most of the units were in Tuen Mun at that time. So we have a unit for Tuen Mun, we're division 2 subcommittee for units in Tuen Mun, and then for the non-Tuen Mun units, we group them all together to have the subcommittees. So it is still mainly looking after the services. And then later on, when we started to have more supported employment services, we set up a work and employment subcommittee, which later on spin off to the social enterprise subcommittee. But given my own higher education background, I also insisted on introducing research and training into the organization. So we set up a research and training subcommittee, which then later on added the development function in 2010. So you can see, starting from 1964, we have a first male halfway house serving 15 clients with 1 staff. To 2017 nowadays, we have over 70 service units or projects with 21 social enterprises serving 15,000 persons in recovery and families, reaching 43,000 general public and over 900 suspended staff, not including those in the social enterprises with contract. And so in 2010, after I took over as the chair, when Dr. Raymond Wu passed away, we had an interim chair, the vice chair at that time, the late Dr. Ng Hon Sing, took over for a few years, and then I was elected as president in 2008. We started to look at our roles and functions and started to review our services, given it's grown so quickly and so such a large organization at that time. So senior management and EXCO worked together in this strategic review exercise to understand the changes in the external environment and the community needs, to shape our future direction for future development, to enhance our corporate governance, and to strengthen the internal teamwork, leadership structure, and corporate culture. Even within our management system, we were relying mainly on the chief executive, who runs everything. And we started to worry about succession planning. What if the person is gone? Who is going to run New Life? So we reviewed the external environment, looking at or some of the changes that are imposed by the government, like lump sum grant. And now we're asked to have best practice manual. We're asked to review our corporate governance. And then we also have increasing input from different government departments apart from the social welfare department, including ICAC, the Audit Commission, etc. So there are more external demands on NGOs. We also did the SWOT analysis on our corporate governance. Some of the highlights we can share with you in terms of how we review our strengths and weaknesses. as I said, we have very dedicated EXCO members who uphold the vision, mission, and values of New Life. We are all concerned about the well-being of our users, and we are all dedicated mental health professionals. We are experienced, competent, and hardworking. But then the roles and responsibilities are unclear for our EXCO members, and also how does EXCO work together with the subcommittee? How do the subcommittee members work together with staff? And then the structure of the subcommittees are also not optimized. But there are opportunities, because we're hoping that we can have, we should be introduced more leadership change, fostering new ideas and culture. And we can, with the increasing service demand and changing service trends, then we need to introduce new blood into EXCO to bring new expertise. We also need to identify our threats with high staff turnover nowadays because of the pay structure and the shortage of mental health service staff. We project our future financial situation, and we projected there may be overall financial deficit because of the increasing pay of our long-serving staff. So these are all challenges that we have to face. Then we try to identify strategic initiatives related to corporate governance. We revisited our vision, mission, and value statements. We reviewed our organizational structure, developed corporate culture in support of the new core values. We also need to review our human resources, pay and benefit policies to enhance the effectiveness of staff management and development, and then review and streamline administration and management policies and guidelines to reduce the bureaucracy and enhance operation efficiency. Then I think one shortcoming of many NGOs is that we have never been very strong with our financial and administration management, because mostly we are dominated by social service providers, and they are not very business-minded. So we need to strengthen our financial and administration management, including in our own EXCO. So we introduce a new finance and administration subcommittee, inviting volunteers from the business sector to join the committee. So what have we done since our review? We revisited our vision, mission, and core values, changing our target clients from what we used to call ex-mental patients to persons in recovery, and also their carers and families. For our mission, we are no longer just focused on psychiatric rehabilitation, but we want to promote mental wellness. And for our core values, I think we stay the same. We should be focused on care for people and excel for quality. With our strategic plan, based on the vision, we set directions and goals for the next 5 years, focus on service development and strategies, and then we also work on our organizational development to build internal strength and professional and management capability. So based on the agency mission, we look at the set up a performance management system by incorporating client, internal process, learning and growth, and financial resources in these performance management system. I won't go into the details in each area, but when we identify our strategic objectives, we focus on the client. What are some of the objectives we should do for our service users, the support network, consumers, and other stakeholders? In terms of internal process, we should be looking at the evidence-based practice and new services. How do we improve our operation model and our business model? For financial resources, there should be proper monitor and control, expand funding sources. And for learning and growth, we should be focusing on how we grow our capital in terms of human capital, organizational capital, and information capital. What have we done? In terms of corporate governance, we articulated the roles and responsibilities of the EXCO. So it's no longer service providing or supervision. We should set direction and strategies and make major policy decisions and oversees the financial status. we reviewed the terms of office of EXCO members and office bearers, so I can no longer continue my role after this year. Formulate skill matrix and diversity for EXCO, review roles and functions of subcommittees, and amend our M&A so that we can correspond with these changes. So a very important lesson for us is to identify successes. And we also prepared the corporate governance manual and implemented the two-tier reporting system on declaration of interest, introduced strategic management, and established KPIs to goals of these initiatives. And then we also expanded the function and the scope of internal audit to manage financial and risk management. So in the last 7 years, EXCO and senior management has joined hands to support New Life in its modernization and growth processes. And I'm very grateful that we have very good working relationship with our management team. But we need to continue learning to keep up with the times. And over 50 years, we are still learning. And I hope that we can continue to learn. Thank you.